yes, all right, we are live. Hello, everybody. Dr. Alex Earl here, and we're Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And today we're going to talk about something which is a pet peeve of mine, okay? But as you guys know, this is a time I get to spend with you guys, talk about plastic surgery topics, and answer all of your burning, yearning questions, okay? We can talk about plastic surgery from head to toe, from start to finish, from pre-op, through the surgery, complications, post-op. I'm happy to answer any questions related to all of that, okay? But today I'm going to talk about this pet peeve of mine because it happens so often, right? We'll put up this beautiful before and after, and there's always going to be someone out there, right? Some troll or someone with some asinine comment or whatever, and they're going to say something like, she should have just gone to the gym for that, or why didn't she just go to the gym, etc., okay? And it really bothers me because patients and women, you're able to do whatever you want with your body, right? It's your body, it's your decisions, okay? So you're not, who are you to tell someone what to do with their body? That's number one. But number two, it's actually quite an ignorant comment, okay? It's an ignorant comment in the sense that, no, the gym cannot fix everything, okay? So is it important? Hell yes, all right? I'm not saying going to the gym, working out, staying toned. I am not saying that's not important. It is definitely important. It's part of the triad, right? If you really want to optimize your results, optimize your body, get the best out of everything, then you have to do, of course, your nutrition, all right? That's number one. And then you got to do your working out, right? Going to the gym, toning up, exercise, okay, and surgery. So you want the best of all worlds, you combine all three. So all three can be very important, okay? But it's not just about the gym, okay? Why is that? Well, what does the gym do, right? What do you do when you go to the gym, right? You go to the gym, you work out, basically you're building muscle, right? You're toning muscle, you're working out your muscles, all right? So what can the gym do? Yeah, it can certainly, tone your muscles, it can build your muscles, and it can get you into better shape, right? And the more you work out, then, the longer distance you can run, for example, and it is overall, you're generally healthier, okay? So definitely a lot of good points about working out, going to the gym. It can even, strengthen your bones as well, especially as you get older. So, lifting some weights and whatnot helps strengthen your bones so that there's less risk of brittle bones as you get older in the future, okay? Especially for women, so that's also very important. Of course, going to the gym, you're gonna burn some calories, okay? And so you can lose weight. So yes, if you combine a healthy diet, nutrition, and going to the gym, and you're on a weight loss journey, definitely it's gonna help you lose weight. And if you add some semaglutide, that's gonna help you even more with that as well. So definitely a lot of pluses of going to the gym. But there are certain things, actually several things, that the gym simply cannot do, okay? So that's why this comment bothers me so much, okay? So let's go over that, And anyone out there who's a gym rat or, whatever, personal trainer, okay, you tell me how the gym deals with a lot of these things, okay? Because obviously it just doesn't, all right? Number one thing that the gym cannot do, the gym cannot deal with loose skin, okay? There's no amount of working out that's gonna deal with loose skin, especially if you have significant, so I would say anywhere from moderate to severe loose skin from, say, such as things as massive weight loss, okay? Or multiple pregnancies, all right? Or just genetics, okay? You can't, sometimes some patients have, just poor genetics in terms of their skin elasticity, and their skin tends to stretch out and become loose. So, say you lost 40 pounds, or say you've been fluctuating in weight throughout your life, right? You see those stretch marks that sometimes get? That means that you've lost elasticity in the skin. Okay, that skin is not like it was when you were younger, when you were a baby or toddler or teenager, okay? It's been damaged over the years, it's been stretched out in the past. You don't regain that skin elasticity, and you end up with loose skin, sometimes with a bunch of stretch marks, okay? So no amount of working out is gonna get that skin to retract. So if the skin's already been damaged because of sun damage, smoking, weight gain, pregnancy, all these things that damage your skin elasticity, it's damaged forever, okay? You can't get it back. Say, for example, what about the breasts, right? You go through pregnancy, the breasts become enlarged during pregnancy, they become enlarged during breastfeeding, and then all of a sudden you stop breastfeeding, right? The breast bounces, the breast kind of volume reduces, but a lot of times the skin doesn't bounce back. And you have stretch marks in the breast and the skin is loose, and so then the breasts become tonic. So I didn't have it on here, but there's no amount of gym work that's gonna make your breast bounce back. If you develop breastosis, okay, or after multiple pregnancies and breastfeeding, right? There's you can't work out the breast, right? It's not a muscle, so the breasts are not gonna bounce back. The only way to do that is to have a breast lift. Similarly, anything that's not a muscle, right? If you have very, very small amounts of breast tissue, there's no amount of going to the gym that's going to enlarge your breast. So you need a breast augmentation, whether you do it via an implant or fat transfer, right? So the gym is not going to work with your breast. All right, so any loose skin. So you have loose skin in the arms, the abdomen, the back, the thighs, okay? The gym can control the muscles underneath there, but it's not going to deal with the skin. And that's why we have procedures such as a tummy tuck, arm lift, thigh lift, okay? Bra line back lift, depending on how much loose skin there is. All right, next, muscle separation. Yes, the gym can tone muscles, work out muscle, build muscle, but it can't make muscles come back together again, specifically what we call the rectus muscles. All right, so the two main muscles that come up and down the abdomen are the rectus abdomini, okay? And of course, they're separated in the middle by what's called the linea alba. Typically, if you haven't had kids or anything like that, that separation is relatively small, perhaps about 1 centimeter or so. However, either after massive weight gain, okay, or multiple pregnancies, that separation becomes wider and something that we call a diastasis. So diastasis is when those rectus muscles are now separated. So instead of only a 1 centimeter separation, now you have 3, 4, 5, 8 centimeter separation. Okay? No amount of sit-ups, crunches, tone defining type of work is going to make those muscles come back together again. Okay? The muscles become ineffective because of that separation. So it just doesn't work. The only way to then fix a muscle separation, again, is with surgery. Okay? And the way to do that is typically with your tummy tuck. So as part of your tummy tuck, we then do what's called, we do the muscle repair, okay? And what we mean by that is that we're bringing the muscles back towards the center. And we're eliminating that diastasis, okay? And this is what I'm talking, this is just talking about diastasis. If you have a hernia for whatever reason, certainly no gym work is gonna make that better. It's actually gonna make it worse. So if you have a hernia, you definitely need surgery to fix a hernia. That's the only way you're going to fix it. That's what I'm talking about, a true hernia there. All right, so yes, the gym cannot fix muscle separation. It certainly can't fix any hernias. Okay? All right, stubborn areas of fat. Fat, the way that the fat is distributed in the body varies from patient to patient. A lot of it has to do with genetics. Okay? And believe me, there's going to be countless women, countless men out there too, where they can be killing themselves at the gym, going 5 days a week, 2 hours a day, have a BMI under 20, and there's still going to be this stubborn area of fat. Sometimes it can be a small area, like right in here. How many times have you seen that? Someone's super fit, all the nutrition in the world, working out at the gym, and they have this stubborn area of fat right beneath the chin, right? It's not going to take care of it. The gym's not going to take care of that. In women, the most common little stubborn area of fat is a little pooch right below the belly button, especially if they've had pregnancies in the past. Okay, so they can have their pregnancy, have the baby, come back, kill themselves in the gym, do all the diets there are out there, and they're still gonna have that little pooch down there. Okay, the only way to do that is to physically remove it via liposuction. That's the most common way. Okay. So it's not going to deal with stubborn areas of fat, which can be anywhere from your chin to the little pooch below the belly button. Okay? All right. What about filling areas where there is no muscle? Well, we talked about the breast, right? If you're flat chested, obviously you can't work that out. You're not going to be able to work your pec muscle to the point of like filling out a breast, right? So that's one example. So for the breast, typically you do a breast dog or fat transfer to the breast for the surgeons that do that, okay? But more commonly, what we do here is what a lot of people call the hip dip. Okay, so that is the area actually just above the hip where it dips in. Okay, and that area is technically called the trochanteric depression. The only thing that there isn't in that area is ligaments. Okay, there is no muscle there. No amount of working out is going to fix a hip dip because there's nothing to build. There's no muscle to build in that area. Okay, so if you need to fill an area where there is no muscle, the only way to do that is by bringing volume to the area. Okay, and the best volume enhancer that we have is your own fat, right? So fat transfer. That's the best volume enhancer that we have, because once that fat settles and it takes and it lives, it's your own fat. It's like the rest of your body, and it lasts forever, the rest of your life. Okay, so definitely not going to be filling in hip dips or anything like that, or any area that needs volume where there is no muscle by going to the gym. In fact, it could probably make it worse. All right, it's probably going to make that area worse, because as you start to lose fat, you lose even more fat in those areas, and then you have more prominent dips. Okay. All right. And then last, but certainly not least, I think this is a very, very important concept to understand, is that when you go to the gym or you lose weight, okay, through nutrition and working out, it's gonna, you're gonna lose the weight and those fat cells. We all know, I think you guys have heard me talk about the physiology of fat and how it works, right? Once you're an adult, the number of fat cells in your body doesn't really change. So what happens, if you gain weight, is that the fat cells that you have, they become larger. And when you lose weight, those same fat cells become smaller. Okay? So when you're working out, yes, you can make the fat cells smaller, but you're not redistributing the fat cells, right? You're not changing the position of the fat cells. So if you have a squarish body, okay, and you gain weight, yeah, you're going to have a wider squarish body, okay? And then if you lose weight, that's great, but you're just going to have a thinner squarish body, okay? Because you're not redistributing the fat cells. Losing weight, going to the gym will not redistribute the fat cells. It's not going to move them around to different areas or different locations, okay? And therefore, it cannot significantly change shape. It cannot change your underlying shape, okay? So how can you change underlying shape? By exactly that. Moving fat cells, removing fat cells from certain areas and placing them in other areas. That's why the BBL is such a powerful procedure, okay? Because you're going to permanently remove fat cells from a certain area, for example, the abdomen and the waist. So you're going to shrink that waist down, and you're permanently removing these fat cells from the area, meaning you're removing them with the liposuction cannula, and they're never going to grow back in that spot, okay? So just to throw numbers out there, if you say you had 1,000 fat cells and you remove 500 via liposuction, then there will only be 500 fat cells there. You're not going to create new fat cells. Your body doesn't do that after you're an adult, okay? And then you're going to take these fat cells and you're going to do basically an auto transplant. You're going to be transplanting these fat cells to another area of your body, say for example the hip dips. Okay? So now you shrunk the waist and you shrunk the number of fat cells in the waist, and now you've added fat cells and volume to the hip dip. So now you've gone from that straight shape to, of course, to that more, oops, wrong way. Yeah. yes. Hold on, let me look at it. There we go. To that more hourglass type shape, okay? Because you've redistributed the fat cells. And then that new shape will remain with you essentially for the rest of your life, okay? But of course, you still want to maintain your nutrition. You still want to be active. You still want to go to the gym as well, just to be healthy, okay? But if you gain weight, then you'll get a wider hourglass. And if you lose weight, then you'll get a smaller hourglass, okay? But you've redistributed those fat cells, all right? Okay, I've talked for a little bit now. I hope that makes sense. But certainly, I'm not saying don't go to the gym. That's not what I'm saying, okay? But that's what these comments are meant, right? They're like, you shouldn't have surgery, you should have gone to the gym. Well, you know what? You're not gonna achieve any of these things simply by going to the gym, okay? The best is combining all worlds. Yes, you do want to go to the gym, and if you want to achieve any of these things, you should have surgery, because that's the only way to do it, and your nutrition, right? It's the triad. Physical activity, nutrition, and surgery to achieve your goals. All right. Happy to answer any questions.
Okay, TikTok. How do you know if you are separate? She's talking about the muscle separation.
So how do you know? Sometimes you can actually even feel it. You put your fingers there in between the muscles in the belly. You can sometimes feel a separation. If you can't feel a separation, it's how you look when you are completely at rest. So say you've had a couple pregnancies, right? And even when you're just like, you're not holding it in, because a lot of times we go around like holding everything in, right? After that. But when you're like just completely relaxed, you can see that your belly kind of still pooches out a little bit, almost like you were still like 3 or 4 months pregnant, okay? If you're having that, then you most likely have a muscle separation and some abdominal weakness from the prior pregnancies or the prior weight.
I got my BBL with Earl. So happy girls do it.
All right.
And working out made it even better, like he says.
Exactly. So that's what I'm saying. So after you go through your recovery period, which in total is going to be your first 3 months, you can certainly start going to the gym and working out. It's very, very important. But let me actually, so after 6 weeks, you can start heading back to the gym. And what we recommend there are weight-based type exercises, okay? Whether you're actually using weights at the gym or the machines or using your own body weight. But that's the type of exercise that we do recommend. For the buttock, we do recommend squats, and that works well, okay? If you want something to do to kind of help you with the heart rate, then we recommend high intensity interval training, HIIT training, okay? And if you do that, then that's definitely going to help you maintain your results for the long term. Certainly after 3 months, you can be a lot more liberal with your nutrition as well. So, because in the first 3 months, I want you to still feed the fat. So you're going to feed the fat for the first 3 months. After that, you can go to like your other, diets or whatever you're on before surgery.
What type of implant do you recommend to give more upper pole fullness?
Right, so I typically recommend well, first of all, my preference is for silicone implants, okay? I think they have a much more natural look and feel as compared to the saline implants. And then if you really want more of the fullness in the upper pole, then I would recommend what we call a high profile, smooth round implant, okay? Smooth is about the shell, so I have some implants here, so it has a smooth shell. I highly recommend that. There's been some reports in literature with textured implants that have some correlation with very rare lymphoma. So I only and exclusively recommend smooth implants. You want to have the round implant with a higher profile, and this one right here, this is what we call a high profile implant, and that's going to give you some nice fullness in that upper pole of the breast.
Dr. Earl, the GOAT, that's all I gotta say. And she sends like hearts.
Hearts? All right, thank you so much. Really, really appreciate that.
A TikTok asked, does the Exparel really work? Is it recommended?
Yeah, so that's great. I do highly recommend Exparel for especially tummy tucks. So the number one surgery where we use Exparel is for your tummy tuck. What is Exparel? So Exparel is a medication that helps control pain for the first 72 hours. It's kind of similar to that, that Novocaine or lidocaine that you may have gotten injected, say when you go to the dentist when they need to numb up something in your mouth. It's kind of similar to that, but rather than lasting only about an hour and a half, it can last up to 72 hours, okay, for the first 3 days. And what we do is that we inject it along that muscle repair, and we also inject it along the long tummy tuck incision. And the patients have a much better pain control in those first 72 hours. A lot of patients are actually they're not needing the Percocet that we prescribe for them, the narcotic. And so a lot of times when you have the Exparel, you can use just Tylenol or after 48 hours ibuprofen and never have to take any narcotics.
Do you recommend a BBL or tummy tuck first, following a large amount of weight loss?
So yeah, so if you had a large amount of weight loss, there's probably at least two things going on. One, you're definitely gonna have a significant amount of loose skin, okay? And two, you're probably gonna have some muscle separation and weakness as well. So because of that, I recommend the tummy tuck first. You wanna do your tummy tuck, you wanna fix the muscles, you wanna remove all the excess skin, okay? So you can then come back around 3 to 4 months later and have a much better result with your BBL. So yes, in general, for I would say over 90% of the cases, I recommend tummy tuck first.
Okay. Do you accept transgender patients?
Definitely, yes, we definitely accept transgender patients. We accept all patients, really. You know, really, it's not about being transgender or anything else. It's about whether you're healthy, right? Okay, so we do have those criteria. So your BMI needs to be under 30. For BBL, age under 50. We're going to check your past medical history, your past surgical history. So if you're healthy and you've been cleared by your doctor and all your labs are good, then you're good to go.
Can anyone get Galflex?
So can anyone get it? The answer is yes. Now, should everyone get it? I don't think so. There are some surgeons out there that are just basically using on everybody. I think that's a little bit of overkill, to be honest, because it's very expensive. Some people may not know what we're talking about, so let me take it back for a sec. What is Galaflex? Galaflex is a mesh that we put typically in the breast when we're doing a breast augmentation or a breast lift with implant, okay? It's a biologic mesh, meaning that eventually it gets incorporated into your body, but what it does is that it helps support the implant so that there's less chances of things bottoming out. And there's also some literature that shows that when you use a mesh, there's a little bit of lower risk of capsular contracture, okay? So those are the upsides. The downside is that this mesh is very expensive, okay? It's about $1,000 per piece if you're using two breasts, of course. It's at least $2,000. I'm talking about, that's like at cost. Like that's what it costs to actually get the mesh, okay? So they're very expensive, so I don't think every single breast case requires it. I typically will not use a mesh if it's a primary case, meaning it's the first time you're having any sort of breast surgery. So if it's your first breast augmentation, your first breast lift, breast reduction, your first breast lift with implants, etc. Now, if it's more complex, say you've already bottomed out, so you're coming in for either a reconstruction type of case or a revision type of case, whether it's mine or somebody else's. In that instance, then I would probably recommend or consider the Galaflex mesh, because now it's the second time that we're going back in, okay, to give a little bit extra reinforcement to hold the implants in place and prevent any possible issues with skin stretching or bottoming out.
Do you work on breast cancer survivors? Also, are patients with sickle cell trait welcome?
Okay, so let me take the last question first. So sickle cell trait is okay. Sickle cell disease we do not take. Okay, so if you have full-blown sickle cell disease, it's just too risky, and the complication rate is significantly higher, and you can go into a sickle crisis, and we don't want to put you at that type of risk when you're doing office-based surgery. Now, for sickle cell trait, okay, then that's usually okay because there is really no risk of sickle cell crises or anything like that, and so those patients we do accept. All right, breast cancer survivors. It depends exactly what it is that you're looking for, right? So if you're a breast cancer survivor, you're in remission, you're not on any immunosuppressive medications, and you're doing okay, then yes, we can typically just in general take those patients. But what I don't do here at Pure, and I used to do it when I was in Cleveland Clinic, but not so much anymore, is breast reconstruction, right? Why? Because typically that's now covered under insurance as part of your kind of whole breast cancer package, if you will. So insurance is going to cover, of course, removal, whether it's a lumpectomy or mastectomy, and then whatever chemotherapy or radiotherapy you might need. And it should, here in the United States, also cover your breast reconstruction. Okay. I don't take insurance here at Pure, but there are several places where of course they do. And if you have questions about that and you want me to recommend someone, I have quite a few buddies that are really, really great at breast reconstruction. I'm happy to make some recommendations.
Could you talk please about the BMI requirement for tummy tucks?
Yeah, so my max BMI is 30, so that's the top for me. Okay. Now it can vary a little bit between surgeon to surgeon. Up to like 33, 33.5. I think it's acceptable. Certainly, I would not consider it at all for anyone who has a BMI of 35 or greater. Okay, why is that? Because the complication rate starts to go way up. Okay, way up in complications rate. What type of complications? We're talking about very serious complications. Okay. The one thing that we're most scared of, that we worry about the most with the tummy tuck, is the potential of a blood clot, a DVT or PE. Okay. And as that BMI starts to go up, the risk of blood clot starts to go up, especially after 35 and above. Okay, it's just not worth that risk. So if you're wanting to do a tummy tuck and your BMI is 35 or above, my recommendation is first to lose weight. Now we have, the glutides. All right, give us a call. Okay, we'll get you started on semaglutide. People lose weight like this on semaglutide. You could potentially lose 40 pounds in 4 months. Okay, so it helps you along with your weight loss journey. You get that BMI back down to 30 or below, or wherever you want your ideal weight to be, and then go ahead and get your tummy tuck. You're gonna have a much better long-lasting result, and it's gonna be a lot safer for you in the long run, and you're gonna feel just a whole lot better. All right, so that's what I would recommend.
Do you fix botched surgeries?
So I do, but I do take them on a case-by-case basis, right? Because what's the number one thing, right? You've had a bad experience, and by the way, I hate the word botched, really. But you've had a bad experience. There's certainly something that didn't turn out well, not to your liking, etc. Okay, and so now you're wanting to fix it, right? So my responsibility as a surgeon is to really, really, believe that I can make it better. That's why it's on a case-by-case basis. Because if a case presents itself and I look at it and I'm like, oof, given my, whatever, current skills and abilities, I really don't think I can make this any better and potentially make things even worse, then I'm not going to take that case, right? I'm not going to do that. It's not about money. It's about, making the patient feel good once again. All right. So I will take it on a case-by-case basis. But if I see a case and I say, you know what, I think we can do, A, B, and C, and this is going to make it look better, then I will take the case. And I always put in that caveat, though. You're starting from a place that is typically a challenge. These are challenging cases, not easy cases. I wasn't the first surgeon that was there. We're starting from a different foundation. So the goal of these types of cases is exactly that, is to make things better. But the expectation cannot be that we're going to make things perfect, and certainly don't think there's any such thing as perfect symmetry. Nobody, whether they've had surgery or not, is perfectly symmetrical from side to side. We all have differences in our hands, our breasts, our buttock, hips, etc., etc. Okay? Never ever expect that you're going to be perfectly symmetrical from side to side.
This question is on TikTok. Ward, she wants to know the name of your clinic and the website to find out how to make the consultation.
Yeah, for sure. So our clinic is called Pure Plastic Surgery. Okay, and the website is www.pureplasticsurgery.com. So let me just write that up here. So www.pureplasticsurgery.com. How's my writing? All right. But that's the website there. And if you're thinking about a consultation, the easiest way to do that is to go to the website, and you're going to see a button there that says virtual consultation. You go ahead and click on that button. It's going to ask you for some information, a questionnaire, and it's going to ask you to upload 3 photos. Okay? You do that, it's going to come directly to our patient care coordinators. They're going to receive that information, and then they're going to reach out to you. So I know exactly the next question. But doc, I want an in-person consultation. Yes, I get it. Don't worry about it. This is the fastest and most efficient way to get in. So you still hit the virtual consult button on the website. You send the information. You send the photos. Our coordinator will then reach out to you, and she'll be happy to schedule an in-person consultation, schedule a video consultation if you're from out of town, different state, different country, or you can just continue with the virtual consult, in which I'm going to see your information and your photos and make recommendations. All right? Okay, awesome. Well, I think that was great. So I hope people now understand what there are certain things the gym just cannot do, and that's why we're here, and we're here to help. Okay, so please don't make that comment anymore. Okay, don't make that comment. She should have just gone to the gym. All right. Well, I look forward to seeing you all next week. Okay, if you have any specific topics that you want me to talk about, just send them to us through through a DM there. Send us a message. I'm happy to talk about it. Okay, but otherwise, I will catch you all next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.